ask everyone to rise for our invocation. Chaplain Gerhardt.
Thank you, Chairman Carter. Would you bow your heads with me? Lord our God, as we begin this meeting of our hospital board, we are reminded of the story of the Good Samaritan. While others passed by the man who'd been assaulted by robbers, stripped, beaten, and left half dead, this Good Samaritan set the example for how we should love our neighbors as ourselves. He stopped what he was doing to intervene for one in need. He bandaged the victim's wounds. He brought him to a safe place. He provided the time and the resources necessary for his recovery. So we thank you today for the high calling of this great healthcare system, and we were reminded that our mission, our vision, and our values reflect the heart of compassion found in the Good Samaritan. Would you, our God, bless our efforts to bring healing and comfort to those in our care? Would you, our Creator, help us to do unto others as we would have done unto us? And would you, we pray, guide and direct this, our hospital board, as they lead the way? These things together we pray. Amen.
Please join me in the Pledge of Allegiance.
Pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Okay, now I'll get this out of your way.
To call to order the meeting of the Sarasota County Public Hospital Board, and any citizen desiring to address the hospital board should turn in a speaker card to the board secretary. If the citizen comment pertains to an item on the agenda today, the comment will be heard early in this meeting. Otherwise, it will be heard towards the end. Speakers are asked to limit their comments to 5 minutes. Vendors, suppliers, or other persons seeking hospital contracts awarded on a competitive basis are reminded that their ability to address the board may be restricted by the terms of the invitation for bid, request for proposal, or other purchasing criteria. Lastly, the board has established a claims adjustment review panel comprised of representatives of the board, the medical staff, administration, and legal counsel to review and negotiate the settlement of claims. Accordingly, the board will not entertain comments on or discuss or negotiate claims at this meeting. I will ask for the approval of the orders of the day.
So move.
If there are no comments, the orders of the day stand. Next, I'll ask for the minutes of the meeting, approval of minutes for the meeting for August 15th.
So move.
We have a motion and a second. Without any comments, the minutes are approved. Do we have any board reports? I don't think we do. So we will move to item 5, which is our annual meet. And this is an event that I look forward to every year. And Dr. Hamad, if you would introduce Dr. Berg, please.
Sure. I'm pleased to introduce Dr. Bruce Berg. He is the Dean of the Florida State University Sarasota Medical School campus.
Thank you. Well, once again, I really appreciate the opportunity to be here and introduce our newest class of the third-year medical students at the FSU College of Medicine. This is the class of 2018. You see them all displayed before you. In 2 years from now, they will all graduate, if all goes well. But by allowing our students to participate in this organization and learn the art and science of medicine at Sarasota Memorial Hospital through your efforts as the community board, you basically have guaranteed that that's what's going to happen and that all will go well for our students. Because at this institution, it's a state-of-the-art institution, it's the very best people, and it's the most up-to-date equipment. So when they graduate, the class of 2018 will follow in the footsteps of all the other graduating classes before them. And as of this last May, with the class of 2016, we've now graduated 168 physicians from our campus alone. And many of them practice at Sarasota Memorial Hospital today. So as most of you know, last December, we celebrated our 10-year campus anniversary. It was at the Ringling Museum, and Sarasota Memorial Hospital was a great supporter of that celebration, but they're also a great supporter of our mission. and they provide the very best clinical education to our students, so when they enter their residency programs, they can become the very best physicians. And on that note, I want to thank you as Sarasota Memorial Hospital, the Community Board, for approving the internal medicine residency program with FSU as a designated institutional authority. Because as the Sarasota campus graduates our medical students, we hope that they will, in fact, go into their residency program at Sarasota Memorial and perhaps any others to follow. So now, I'm going to ask the students to come up one at a time, give their names and the cities they came from. Thank you.
Hello, my name is Javier Ayo, and I'm originally from Miami, Florida.
Hello, my name is Boris Feinberg, and I'm originally from Fort Lauderdale, Florida.
Hello, my name is Patrick Rushford, and I'm originally from Naples, Florida.
Hi, I'm Scylla Edmonston, and I'm from Ponte Vedra Beach, Florida.
Hello, my name is Matthew Klein, and I'm originally from Clearwater, Florida.
Hi, my name is Laura Morales, and I'm from Sarasota, Florida.
Good afternoon. My name is Catherine Shomody Stevenson, and I'm originally from right here as well, Sarasota. Thank you.
Hi, my name is Dijo Joseph, and I'm originally from Dover, Florida.
Hello, my name is Harrison Brown, and I'm from Vero Beach, Florida.
Hello, my name is Michael Alexander, and I'm from Sarasota, Florida.
Hello, my name is Juno Lee, and I'm from Odessa, Florida.
Hello, my name is David Alarcon, and I'm from Miami, Florida.
Hi, my name is Tatiana Pizzito, and I'm from Clearwater, Florida.
Good afternoon. My name is Michelle Yazo. I was born in Bogota, Colombia, and my family lives in Cape Coral, Florida. Thank you.
How are you doing? My name is Justin George, and I'm from Fort Lauderdale, Florida.
I'm Catherine Gonzalez, and I'm from West Palm Beach, Florida.
Hello, everyone. My name is Alexia Igus, and I'm from Tampa, Florida.
Hello, my name is Kaylee Kishel, and I'm from Tampa, Florida as well.
Good afternoon, everyone. My name is Julia Teitelbaum, and I'm from Clearwater, Florida.
We have one student missing. She had to travel too far. She's in Port Charlotte today working, and that's Nina Morgan. Actually had the opportunity to work with Karen Hamad. And she's from Sarasota. Yeah, she's from Sarasota. I think we have 4 students from Sarasota this time around. Again, thank you very much. We really appreciate the opportunity and do a great service for our students. Thank you.
David, if you would announce the Excel Award winner for September, please.
I would love to. Thank you, Mr. Chairman. So, Christine Hale, could you come up and join me? You can clap. Please stand by me, if you don't mind. Okay. So, I am happy to introduce our board and our community to Christine Hale, who's our Excel recipient for September. Christine is an RN in radiology nursing services and has been with Sarasota Memorial since 1994. Everyone who nominated Christine said they valued her as a team player, and she is a part-time employee, which really means a whole lot. She will switch shifts or pick up shifts, her coworkers say, to ensure we're staffed to provide extra patient care. Christine will go above and beyond. Her can-do attitude has earned her respect from her peers the IR physicians, and staff. Christine has many years of critical care experience. She handles all situations with expertise. Even when called in at the earliest hour, even when it's an emergent procedure, and even under the most difficult circumstances, she maintains her calm, friendly, and professional demeanor. Christine is always smiling and eager to assist her patients and her co-workers. Thank you so much for everything that you do. We appreciate it.
I appreciate it.
Now, I'm going to ask Mr. Carter to come up and read this plaque to you.
Congratulations, Christine.
Thank you.
The Excel Award. Excel recipients are employees who are models of excellence and consistently demonstrate the mission, vision, and values of our organization. They are superior performers that make an extra effort in the quality and care of our patients and families in the community. Hospital Board and administrative staff of Sarasota Memorial Healthcare System recognizes you, Christine, with the Excel Award for the month of September 2016. For your continued dedication and excellence. It's signed by David Werner, our CEO, and myself as chairman of the board. Congratulations and thank you.
Christine, they would love to hear from you. Do you have a minute to
Actually,
say something?
Yes, I really appreciate this award. I am very honored. Like he said, I've been here since 93 or 94. And I've seen this institution grow tremendously. I am very proud to be a part of it. I have a wonderful unit. My boss, Dwayne, he's been wonderful, and I just thank everyone.
So I believe next, Mr. Carter, you have another award to give away?
Yes.
Okay, so we have a resolution for you to read.
This time, this is not on our agenda today, but we have a special occasion, a very important occasion, and a resolution for Bob Strasser, if he would please join me. Bob Strasser is a former member of our board. He had just had to step down from the board. Come over here so she can take a picture.
Good, thanks. Good.
Okay. And he has been a board member when I came on the board 14 years ago. And he has been, to me, the gentleman of the board. Absolutely. If you look in the dictionary under gentleman, it'll have his picture.
Oh, thank you. Absolutely true.
He has been an outstanding board member. He gives his all to the board. We are sorry to see him leave the board. So we have a resolution from the Sarasota County Public Hospital Board that I'd like to present to you, Bob.
Thank you.
Whereas Robert K. Strasser is hereby honored for his exemplary service and honorable 22-year term with the Sarasota County Public Hospital Board, and whereas Mr. Strasser has demonstrated outstanding leadership, serving with distinction and great capability, he has provided a wealth of wise counsel, common sense, and good judgment during the years. And whereas Mr. Strasser has been an invaluable resource, helping the board skillfully manage growth, strategy, and governance. As a board member, he helped guide the organization through new programs to enhance patient care, including the establishment of the First Physician Group, the building of the Critical Care Tower, and the freestanding Emergency Care Center in Northport, the development of new urgent care centers, the building of the Courtyard Tower, the opening of the new Trauma Center, and the launch of the SFU residency program. During his tenure, Sarasota Memorial received numerous honors, including achieving initial magnet designation and multiple redesignations, U.S. News and World recognition, the Gallup Great Workplace Award, and many others. And whereas Mr. Strasser's commitment to SMHCS has been second to none, he selfishly has devoted countless hours to committee meetings, employee gatherings, and appointments with hospital advisors. He always makes himself available for any business connected to the hospital, working tirelessly to ensure top-notch health care for the entire community. And whereas Mr. Strasser is much admired for his prudent and diligent role as steward of this organization, a wonderful ambassador for the organization, he has devoted all of his time and energy to making sure Sarasota has access to world-class medical services, physicians, and staff. And whereas Mr. Strasser's kindness, wit, and seemingly endless supply of unfailingly chuckle-inducing jokes have been a constant source of joy to those who have had the benefit of working with him. Now, therefore, be it resolved that although Robert Strasser is completing his tenure on the board, his colleagues and the community are grateful for his excellent service to the organization, Sarasota Memorial, and indeed the community as a whole will long benefit from his contributions for his extensive and distinguished service on the hospital board. Be it further resolved that Robert Strasser will be honored for his outstanding leadership, and his name and accomplishments will be set down upon the records of this great healthcare system. And it's signed by David Verender, the CEO, and myself as chairman of the board. Thank you so much, Bob.
Thank you. I just want to say it's been an honor and a privilege to be a member of this hospital, Sarasota Memorial, a fantastic hospital. Thank you.
Man, a few words.
Yes.
Yeah, we expected to go on a while. But we have a heavy thing here for you.
Oh, thank
okay?
you, David.
But what I'm going to do before I just give it to you, I mean, you can look at it and see it. It has your name on it.
Very nice.
Okay. Then I'm going to box it up for you, if that's okay.
Thank you.
Read everything on there that we could possibly, think of to say, except thank you.
It's hard to believe all these things that I'm not sure.
Yeah, no, he didn't make any of them up. They're all very true. On behalf of the hospital, the employees here, and our physicians, and and myself. I don't know if you remember, you interviewed me 10 years ago for this job.
I do.
And I very much appreciate you hiring me.
Well, thank you.
All right. Thank you, my friend.
Is he still there? Greg, could I say something?
Yes, please, go ahead.
Bob, before you leave, I just want to say when I came on the board 12 years ago, if you remember, you were the chairman of the board, and it was a very wonderful, instructive, collegial first year, and every year since then. So we'll miss you. Thank you for all your service.
Our next item will be the report of the medical staff. Dr. Karen Hamad.
Thank you. The Medical Executive Committee is requesting a recommendation to approve the Pediatric Department rules.
I move approval of the amended rules of the Pediatric Department as approved by the department and recommended by the Medical Executive Committee.
Second.
We have a motion and a second. Any questions or comments? Seeing none, all those in favor of the motion, please indicate by saying yes.
Yes.
Opposed? Motion passes. Thank you.
Okay, the Medical Executive Committee requests the recommendation to approve the OBGYN department rules, which have been updated.
I move approval of the amended rules of the Department of Obstetrics and Gynecology as approved by the department and recommended by the Medical Executive Committee.
We have a motion and a second. Any questions, comments? Seeing none, all those in favor of the motion indicate by saying yes.
Yes.
Opposed? Motion passes. Thank you.
Okay, the Medical Executive Committee requests the recommendation to approve the post-acute care medical directorship.
I move approval of the medical directorship for post-acute as forwarded from the Medical Executive Committee.
Second.
We have a motion and a second. Any questions, comments? All those in favor of the motion indicate by saying yes.
Yes.
Opposed? Motion passes. Thank you.
Okay, the Medical Executive Committee requests the recommendation to approve the Progressive Mobility Protocol.
I move approval of the Progressive Mobility Protocol as recommended by the Medical Executive Committee.
Second.
We have a motion and a second. Any comments or questions? All those in favor of the motion indicate by saying yes. Oh, I'm sorry.
Mr. Carter,
Yes.
when I was reading through that protocol, I didn't notice a whole lot in there regarding the progressive mobility for neurological damaged people. I'd like you to like the Medical Executive Committee, take a look at that, please.
Okay, sir.
Good. Any other comments? All those in favor of the motion, please indicate by saying yes.
Yes.
Opposed? Motion passes. Thank you.
The Medical Executive Committee would request recommendation to approve the ARNP's ordering controlled substances state law approved July 1st, 2016.
I move approval of the addition of controlled substance ordering privileges for advanced registered nurse practitioners, consistent with state law as amended effective July 1st, 2016, and as recommended by the Medical Executive Committee.
Second.
We have a motion and a second. Comments or questions? All those in favor of the motion, please indicate by saying yes.
Yes.
Opposed? Motion passes. Thank you.
Okay, and the Medical Executive Committee requests a recommendation to approve extending the closed cardiovascular services.
I move approval of the 6-month extension to January 2017 of the moratorium on accepting applications for new medical staff members for cardiothoracic surgery to allow additional study of the issue of closing membership in that area as recommended by the Medical Executive Committee.
Second.
We have a motion and a second. Questions or comments? Seeing none, all those in favor of the motion, please indicate by saying yes.
Yes.
Opposed? Motion passes. Thank you.
That's the end of my report.
Thank you, Doctor. Our foundation report, Jim Seifert.
Thank you very much for this opportunity to be with you today.
Glad to have you.
First, I'd like to say that the search committee's work for the new president for the foundation is drawing to a close now. And I think that by the time I come to your next meeting, we should have specific information for you in that regard. So thank you all very much for your patience, but it's been as fast-moving as we could make it be.
Okay.
Now I would just again like to review some of the events that are coming up and extend the invitation to each of you to have tickets in hand when these dates arrive. So, the Key to the Cure, October 27, 2016, which will be at Saks Fifth Avenue at the UTC Mall. Over the 11-year history of that event and the cooperation between Saks and Sarasota Memorial Healthcare Foundation, the partnership has raised more than $1.1 million over that period of time. The ticket sales at the present time are over 600, and the goal is to have ticket sales of 1,000. The sponsorships are $210,225 at this point, and the goal is $240,000. That's more than double last year. And a great deal of the credit for that goes to a young lady sitting in our audience, Sally Shule. Would you stand up and take a bow, my dear? There is a family in town, the Snyder family, that because of the incredible care that their mother had at Sarasota Memorial Hospital during her lifetime, established a golf tournament that they do essentially 95% of the work for, or 90% of the work, and they meet all of the expenses to put this event on. and then they donate their net from that event each year to the foundation to go to Sarasota Memorial Hospital. And during the 18 years that this has been going on, that event has raised $300,000. And it is essentially averaging somewhere around $20,000 a year. So I just think that the foundation, without question, and Sarasota Memorial Hospital are again experiencing a grateful patient family that we hope to see much more of in the future year. The Corinthian Society celebration is December 1, 2016 at Sarasota Yacht Club. That event honors and really pats on the back the major donors and small donors, but especially the major donors. And we are looking forward to an exceptionally good Corinthian Society celebration this year and the presentation of several of the medical jackets and stethoscopes that require a $50,000 donation, either as a single donation or cumulative value. So hopefully we'll have several people up there with that. Women in Medicine, which is January 27, which will be held at Michael's on East. The theme this year is cardiac care. The speakers are Dr. Chippy Naluri and Dr. Jeff Sell. The ticket sales at the present time are at 326. The goal is 400. Sponsorships are at 74,200 already. The goal is 85,400. Last year, the sponsorships were 34,000. The projected net this year is 117,000. Last year, it was 50. So every place that we can improve, we have been working very hard to do so this year. The EPIC campaign has raised $80,588, and that is through the present date. And the EPIC campaign is just an amazing thing in my view, because those donations come from the hospital employees. And not only does the foundation praise the work that you guys do, but the hospital employees obviously do too. So that's a great pat on the back, I think. And then there is the Sarasota Memorial Hospital Foundation Golf Tournament, which is May the 5th, 2017, at Laurel Oak Country Club. So I know there are some golfers sitting around on this board. Break out your clubs this spring. Last year, the event netted $90,843. So we intend to clearly and excessively break 100,000 this year. So bring your clubs. Thank you all.
Good. Thank you, Jim. Excellent report. Thank you.
Thank you.
Next, we have the Secretary's report. Jim Meister.
Thank you, Mr. Chairman. This evening at 5:01 in this room will be the final tax millage and budget hearing. When we look at the October calendar, the next regularly scheduled board meeting will be on Tuesday, October 4th, starting at 8 a.m. for the board breakfast, 9 a.m. for quality, 10 a.m. for mission and planning, 11 a.m. for governance, and at 12 p.m. the audit committee. The next day, October 5th at 5:30, everyone is invited to join us for the ribbon cutting of our 6th Urgent Care Center at St. Armand's. That's from 5 to 6:30 p.m. On October the 17th, we will have at 11 a.m., the 24th, we will have a review of the financials to the board, and the public meeting will be at 1 o'clock to 2:30. And to reiterate what Jim said, on October the 27th at Saks Fifth Avenue at UTC will be the Key to the Cure affair, and we hope to see a lot of folks there with us. Thank you, Mr. Chair.
Okay, thank you, Jim. Treasurer's report next. Mr. Darrell Henry.
Thank you, Mr. Chairman. I move approval of bad debts and charity care for the month. Public, listen on TV, this is for the month. Ending August 31st, 2016, in the amount of $20,823,000, which I will remark is baked into our annual budget, so it's not an extra amount of money we have to come up with from somewhere. It's managed within the budget this hospital operates under. Congratulations, management team.
Second.
We have a motion and a second. Any questions, comments? Seeing none, all those in favor of the motion, please indicate by saying yes.
Yes.
Opposed? Motion passes. Thank you, Darrell. Next, we have our operations report. We'll start with Bill Wolchin, our Chief Financial Officer.
Thank you, Mr. Chairman. I have the financial highlights for August. For operating revenue for the system, for the month of August, we had $62,165,000 compared to a budget of $52,084,000. For our fiscal year to date, which represents 11 months of activity, actual operating revenue is $655,934,000 compared to a budget of $605,172,000. Total expenses for the system for the month of August, $54,327,000 compared to a budget of $53,218,000. Fiscal year to date, total expenses of $620,063,000 compared to a budget of $600,830,000. For the system, our operating income for the month of August, $10,507,000, which generated an operating margin of 15.9%, compared to a budget of $1,654,000, or an operating margin of 3%. Fiscal year to date, and again, it's 11 months of activity, actual operating income of $66,560,000, which generates an 11-month operating margin of 9.5%, compared to a budget of $34,608,000, a budgeted operating margin of 5.3%. Looking at some statistics for the hospital, and these are all year-to-date numbers, fiscal year-to-date. Average daily occupancy, 473, compared to a budget of 437. The average length of stay this year so far, 4.62 days, compared to prior year at this point, 4.75 days. Admissions through 11 months, 29,370, compared to a budget of 25,192. The hospital's surgery cases, 19,566 actual, compared to a budget of 18,653. Births have been 3,175 over 11 months, compared to a budget of 3,105. The hospital's outpatient registrations total 386,535, compared to a budget of 397,537. The emergency care center registrations, 114,372, compared to a budget of 101,991. Through 11 months, the case mix index for all patients stands at 1.86 on average, and for Medicare patients, 1.98 on average. Mr. Chairman, that concludes my report unless there's any questions.
Okay. Thank you, Bill. And now we'll have the operations report from our Chief Operating Officer, Lori Lang.
Good afternoon.
afternoon, Mr. Chairman, members of the board. I'd like to begin with a capacity update. Bill just finished sharing with you that our volumes are up in pretty much every category year over year. And so when we know our beds are finite and we have growing volume, we have a capacity problem because we have been full at various times in the last 2 years. So as our volume grows up, we need to figure out how we can accommodate that growth. And so I'd like to thank members of the medical staff and members of all of our staff because they've worked very hard to get to the point where I'm going to show you today. So there's many components that go into capacity. One is your volume and one is length of stay. And so if your volume is going up, to create capacity, you really need to start make an impact on length of stay to create that ability to accept that growth. And so in 2015, you'll see we hit a high point of 4.98 days of length of stay. We embarked on this project called Capacity, and many of our tactics were started to be implemented in January of 2016, and we dropped from 4.98 days to 4.75, and this past month we dropped even further to 4.48 days. And so why that's important, if you look back to January, an average length of stay of 4.75 days is 114 hours. When we drop to 4.48 days, that's down to 107 hours. And so for every admission, we have actually squeezed out some inefficiencies of about 6.5 hours per admission. And that creates capacity. And while average length of stay is important, we know that our patients actually want to go home. We strive very hard for every patient to have a great experience here, but there is no place like home. So let's talk about our growth a little bit. Our inpatient cases or admissions grew by almost 14% from fiscal year 15 to fiscal year 16. So when you pull out together, we look at our average daily census. And this graph is not new to this board. It shows tremendous growth year over year, and the blue line is fiscal year 16. When we take the average daily census for the whole year, we were 473 patients compared to the average in fiscal year 15 of 434. So while we've had an 18% growth, we've actually only had an 8% growth in our average daily census. And so this is a proof that our capacity initiatives are working. We've been able to accommodate that huge growth with no additional beds through our gained efficiencies. So how have we done that? It's been a number of initiatives of the departure lounge, discharges before 1 o'clock, and now in our logistics center, which we opened earlier in the fiscal year, actually tomorrow we are going to launch the transfer center. Let me tell you what that's going to look like. When a physician or another hospital believes that they need to transfer a patient to a higher level of care for either technology or physician services, that physician or hospital calls our hospital, and this transfer center will be located within the logistics center. The logistics center gets some key information to determine who would be the most appropriate accepting physician. And in step 3, there becomes a 3-way conversation. The accepting physician, the transfer center, and the transferring hospital or physician. There's a conversation of what are the necessary resources to make this a safe transfer. For example, does this patient need to go to the OR? In what time period? Do they need blood products? Do they need to go to an ICU bed? Do they need a private room? And we then figure out how we can accommodate all of those needs. We say yes and accept the patient, and then the logistics center coordinates the transportation either by air or by ground, so we can accommodate this transfer from another facility. And so why is this important? Well, we've been tracking our transfers over the last couple of years, and you can see from 2014, we started to see really exponential growth. because we are a tertiary and many times a quaternary level facility. And in 2016, we're going to have greater than 565 transfers from other hospitals. And I would say that probably in 2017, we're going to be well over 700 patients. Moving from hospital operations to construction, some exciting things to share. In July 25th, we opened our new interventional suite offering angiography. We anticipate that we're going to have greater than 600 cases in this room, and it came under our budget of $2.3 million. And what I just love to see is how that room on the left is transformed to the room on the right. The next construction project that'll be completed at the end of the week was our electrophysiology lab. We renovated and upgraded that facility, and this will open at the end of the week, and that construction budget was $2.5 million. ICU renovations. It has been a challenge to upgrade our ICU beds because we've needed them. So it's been hard to figure out how you take down, suites and pods to accommodate these upgrades. So we have 16 beds that are coming online. 8 on 5EA will be completed at the end of October, and 5EB will be completed mid-November. And this completes all renovations of our ICU pods, which gives us 62 critical care beds. Moving from inpatient to outpatient, our urgent care center at St. Armand's will be opening at the end of the month. Officially, the opening date is October 1st, but we will have a soft opening on September 29th. It is a 3-floor building with a third floor of about 4,000 square feet that'll be available to us for future growth. The second floor will be our urgent care centers with 12 exam rooms, general radiology, an anti-coag clinic, and laboratory services. This is part of our urgent care and ambulatory strategy, and you can see the dates in which we've opened other facilities. This is our 6th urgent care center, and in 2017, we will be topping over 100,000 visits, making it easy for patients to get urgent care close to where they live and at a price point that is much more reasonable than having to come to an emergency department or an ECC when their care really is at the urgent level and not at the emergent level. And finally, and most exciting, is our rehab pavilion. And you can see that it is going up quickly. The picture on the top left-hand corner really shows the scale of this building. I think we all thought it would be big, but it really is big. And it's exciting to watch it. The walls go up on the interior, which you can see on the bottom right-hand corner. And the elevator is going in this week, which means David and I can don our hard hats and walk through the facility. We ask every week, when can we walk through? So we are expecting our certificate of occupancy the week of December 12th with a grand opening. Please mark your calendars for Saturday, December 17th. There will be tours between 9 and 12 with a grand opening and a ribbon cutting at 10:30 in the morning. And I would be remiss not to do a shout out to our construction and architectural team with all of this construction that goes on, keeping our facility up to date. We have over 1 million square feet of facility before we add the rehab pavilion. So Jim Bugash and Tom Perigo are just simply amazing. Whenever we ask them to do something, the answer is yes, we can, even when we're opening on time, and they know the answer is yes, we will. So thank you to both of those leaders and for their amazing hard work. Are there any questions? Thank you.
Thank you, Lori, very much. Now we'll move to our committee reports, and we'll start with Mission and Planning. Marguerite Malone.
Thank you, Mr. Chairman. The Mission and Planning Committee met on September 6th this year, and our first order of business was a discussion by Frank Morgan and Dr. Frank Burns about our Health Direct program. Now, this is a program modeled after our employee health, and what it does is provide an opportunity to local self-funded employers with 50 or more employees to take advantage of the approach we use within our own healthcare system. And that approach is that we have an established network, so it'd be easy for patients. We have integrated medical management, which again makes it much easier for patients. And we have a flexible plan design. And so companies now with 50 employees or less who are going to hear all about it, some of them have already heard all about it, will have the opportunity to come into this program for their employees. And the potential market includes Sarasota County government, the school board, the city of Sarasota, PGT, and Tervis Tumblers, for example. So there are a number of options around the community. Secondly, Lori, our COO, talked to us about our new patient advocate and concierge program. And this was an update on all of the effort that's gone forward to have a really outstanding centralized response to patient and family concerns regarding any hospital stay. So there'll be one number, a family member or the patient can call in or see the person, and that will generate then the whole flow of services and requirements that that family or that patient may need. It's expected that that will really much better meet all the patient inquiries and concerns than a decentralized system would. And so the timeline is hiring a manager by the end of September, so we're right on top of this, and then all the logistics that have to be done in order to make it happen. But we expect it to be a very successful and really helpful program. Thirdly, we talked about the pediatric ambulatory clinic at Northport, and again, Lori presented the latest information on that. And we've partnered with Johns Hopkins All Children's Hospital, and these pediatric services are going to be at our Northport 24-hour ER upstairs where we have office space. We currently have 18,000 square feet of existing shell space, which we did initially because we knew we wanted to help draw doctors, physicians, and staff into the Northport area. So Johns Hopkins All Children's will lease and staff a 7,500 square foot pediatric specialty clinic there, and then that will be able to serve the Northport community, which has so many young children. So there's a projected opening date on that of March 2017. We at SMH are investing $1,237,500 to construct this space, and then Johns Hopkins All Children's will lease the space at a fair market value over a 7-year time period. So at this time, I move approval of the funding in the amount of $1,237,500 as budgeted in the FY16 capital budget for the construction of a 7,500 square foot clinic space at our Northport campus as recommended by the Mission and Planning Committee.
Second.
We have a motion and a second. Comments or questions? Seeing none, all those in favor of the motion, please indicate by saying yes.
Yes.
Opposed? Motion passes. Thank you.
Our next order of business was to talk about the Northport Pediatric Specialty Clinic selections. And Tom Perigo, who handles all this construction that Lori talked about, discussed the selection committee's recommendation for the selections at this Northport Pediatric Specialty Clinic. And so what he did was provide us with the committee, with the results of the selection committee for their listing of the architects and engineers and the general contractors. So at this time, I move approval of the ranking of the architects and engineers for the Northport Pediatric Specialty Clinic as ranked by the selection committee and recommended by the Mission and Planning Committee as follows. Number 1, Besselo Design Group Incorporated. Number 2, C. Allen Anderson Architect. And number 3, Strollo Architects Incorporated.
We have a motion and a second. Comments or questions? All those in favor of the motion, please indicate by saying yes.
Yes.
Opposed? Motion passes. Thank you.
And I now move approval of the ranking of the general contractors for the Northport Pediatric Specialty Clinic as ranked by the selection committee and recommended by the Mission and Planning Committee as follows. 1, J2 Solutions. 2, Willis Smith Construction. 3, MES General Contractors.
We have a motion and a second. Any questions or comments?
Yes, please.
Yes, Darrell.
We have had remarkably good luck with our rehab facility contractor, who also built a new tower. Their error rate or injury rate has been 0 through all these man hours and time that they put in. I'm disappointed they didn't show up on the list of contractors. Perhaps they didn't bid.
I don't know if they were invited on this one because of worse load or whatever they may have had.
Okay.
This might have been a smaller project for them.
Nonetheless, compliments to them for their past work. Their bid is missed.
Any other questions, comments? All those in favor of the motion, please indicate by saying yes.
Yes.
Opposed? Motion passes. Thank you.
And that concludes my report, Mr. Chairman.
Thank you. Now can we ask you to give the Quality Committee report?
And as is always the case, we have a Quality Committee meeting every month. And as required by state law in the state of Florida, it is a closed meeting. So at this time, I do not have any report from that committee, except to tell you that we work hard and we do a lot of stuff in it. Thank you, Mr. Chairman.
Thank you, Marguerite. Next, we have the Finance Committee report. Jim Meister.
Thank you, Mr. Chairman. The Finance Committee met on September 6th. Bill Volgen, our CFO, reviewed the year-ending 2017 operating and capital budgets and reviewed the growth initiatives, budget volume assumptions, and budget challenges for year-ending 2017. After a discussion, a motion was unanimously passed to recommend approval by the board of the 2017 operating and capital budgets and setting the tax millage rate at 1.0525 for fiscal year ending 2017. The 2017 year-end operating and capital budgets was preliminarily approved and the tax millage rate preliminarily set at the board's specially noticed meeting on September 6, 2016. The final approval of the budget and the setting of the tax rate will take place here at 5:01 this afternoon. To move on, if I may, Dr. Hardy Schwartz, Medical Director of the Non-Invasive Cardiology, and Jennifer Sullivan, Director of Cardiovascular Services, presented the need for replacement of the cardiovascular information system. The current system is nearing the end of its useful life, and it does not have the capability for physicians to read studies remotely. With the new system, we will be able to have stat-ready reading ability, leverage workflow efficiency, improve patient satisfaction, and improve physician satisfaction with remote study reading capability. And I have a motion to propose, Mr. Chairman. I move the approval of the purchase of software and hardware for an updated cardiovascular information system with the total project budget of $2 million with funding of $1,500,000 coming from the 16 capital budget and $500,000 from the 2017 capital budget as recommended by the Finance Committee.
Second.
We have a motion and a second. Do we have any questions or comments? Seeing none, all those in favor of the motion, please indicate by saying yes.
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 Opposed? Motion passes. Thank you.
I have two other items, Mr. Chairman. Bill Volgen described an opportunity to file a claim on a settlement fund resulting from class action lawsuits regarding municipal derivatives brokers and providers who were alleged to have conspiring to fix, maintain, or stabilize the price of municipal derivatives in violation of federal antitrust law. The settlement fund is in excess of $100 million has been created. Management is working with council to file a claim to the fund. And lastly, Diane Settle, Vice President of Revenue Cycle Management, and Jill Aspinwall, Supervisor of Revenue Cycle, presented an update on the process improvements made to reduce late charges and centralization of reimbursement analyst. This concludes my report, Mr. Chairman.
Thank you, Jim, very much. Our next item on the agenda is the Human Resources Report. Our Chair for Human Resources is not here today. He's not present, so there will be no Human Resources Report this month. That brings us now to the President's Report. David Verender, President and CEO.
Thank you, Mr. Chairman. So I'm going to start today, as I always do, looking at our organizational report card. Today I'm reporting on our fiscal year to date, 2016 through August. We start in our service pillar and we look at our HCAP scores, which are an indication of our patient satisfaction from our inpatient side of the business. We have a goal of being 9 out of 11 of the domains being at 50th percentile or higher. We are a little bit short of that. We are at 7 out of 11, and we'll look at the detail of that here in a minute. On the outpatient side, we have a goal of being at 55 out of 58 of the domains being greater than the 50th percentile. And I'm happy to report we are exceeding that. We're at 56 out of 58, and we'll see the details of that here in a minute as well. In the people pillar, as everyone remembers, this year we changed our indicator to start looking at turnover of part-time and full-time employees that have been hired within the past 12 months, as that's the most costly area of the people part of turnover. We had a goal of having 34% or less for the year. I'm happy to report that we've made substantial improvement under Lori Lang and Lori Bennett's leadership. And have reduced our overall turnover to 27.08% and continuing to make improvement from there. Quality pillar, our infection prevention indicator, which is our combined overall standardization infection rate. By definition, the national average is 1.0. We had set out a goal of being at 0.95 or less for the organization. I'm very happy to report we're making great strides in that. And we're at 0.87, so considerably less than the national average. In the finance pillar, you saw the numbers that our CFO, Bill Wojcik, reported earlier. We had an operating margin goal or a budget of 5.2%, and we are projecting to exceed that by end of the year and be at 9.1%.
Yes.
I appreciate that.
Yes.
Bill does too. In the growth pillar, we have two goals. We have our inpatient admits and observation patients. The goal of being at 35,301. We are projecting to exceed that as well and be at 39,259 by end of the year. End of the year, of course, being September 30th. The other growth pillar has been our outpatient registrations. We have a goal of being 747,000. We're projecting to exceed that right now, although it is close. It's at 748,259. So when we keep looking on, we'll look at our HCAPS report card, and what you have here in front of you are the 11 indicators that are nationally reported in HCAPS. On the left-hand side, what the current national average of each one of those is, and then what our fiscal FY15's fiscal year-to-date number is. So you can see that the ones in the middle that are showing up red, we are a little bit below the national average. Those being responsiveness to hospital staff, communication with physicians, cleanliness of hospital environment, and quietness of the hospital environment. We are close to the communication with physicians, but it's a high bar to set. And when you look at our number nationally at 7, and certainly locally, we still exceed most all facilities nationally and certainly locally. Good bit of work, a lot of teams going on this, and we hope to have improved numbers. When you look at our outpatient stats, you can see that we're actually hitting all the goals in each one of the different departments on the left-hand side, with the exception of ambulatory surgery. Ambulatory surgery started the year at quite a bit lower than 4 and has made up a good bit of ground, so we thank them. They're still trying to close that gap of the two, but we are definitely hitting our goal right now at being 56 out of 58. Moving on to people, children. This is a children visit our SMH Public Safety Department. Just got a couple pictures here. This past September 6th, a classroom from our child care centers came for a visit to learn about our heroes. Our officers showed the children their fleet, let them try on pieces of the uniform, and gave them a tour of the Central Command Center. I mean, I think you can probably see by their faces they all had a great time. Mickey, you in the back? Did you enjoy that? So we appreciate you, Mickey, being a good sport and entertaining the guys. We also had our annual Heart Walk, which was a huge success as we always have. We had an estimated 1,500 people attended the American Heart Walk Association's Suncoast Heart Walk on September 10th. The organization's signature fundraiser is intended to help fight heart disease and strokes, the number 1 in 5 causes of death in the U.S. Congratulations to Sarasota Memorial, whose 182 team members raised over $15,000, and we really appreciate everybody who showed up for that. Now, I didn't really know where to put this, so we just put it in the people section. We had a recent graduate come to our pet therapy stars, Webster, as you can see him there. So if you see Webster going around the halls with his other friends, feel free to shake his paw and give him a congratulations. So this is really something that really means a lot to our patients, and you can see people light up when our pet therapy stars come around. Look at quality for a minute and talk about a trauma patient story. So if you bear with me for a minute. Sarasota Memorial's trauma team recently held a special trauma grand rounds educational event sharing patient success stories and key quality indicators. More than 150 Sarasota Memorial staff members, first responders, and community health partners attended the session. One of the success stories featured a patient who was riding his bicycle in Northport when he was struck by a vehicle. He suffered a number of traumatic injuries, including spinal cord bruise that resulted in temporary quadriplegic, and was cared for in Sarasota Memorial's trauma intensive care, neuro, and comprehensive rehab units. When he finally went home earlier this summer, he was able to walk unassisted and jog for short periods of time. During the Grand Rounds event at SMH, he was reunited with the Northport Fire Rescue personnel who responded to his accident, and the trauma surgeons, nurses, and rehab therapists who care for him during the stay. Since opening the trauma center in May of 2015, SMH has treated more than 2,600 injured patients. The service's overall mortality rate is 2.84%, which is well below the National Trauma Data Bank benchmark of 4.31%. And in that picture you have on the far left-hand side, Dr. Awali, who really has headed up that team. And I just want to extend my heartfelt thanks to the board who believed in us and allocated the funds and the resources to be able to do this. To the medical staff, Dr. Hammond, if you could pass that on. It's a great burden that they accepted and went on. And then, of course, our own staff who also came up and did what they needed to do. So it really is making changes in everybody's lives. So thank you all. Staying in quality, SMH and Sarasota Herald Trib hosted a panel on Zika virus. So last month, the Sarasota Herald Tribune and Sarasota Memorial convened a panel of experts for a community forum on the Zika virus. The panel shared information on how Zika is spread and how people can protect themselves. Detailed information can be found on the Florida Department of Health, CDC, and SMH websites. And I would just encourage you to go on there and educate yourself about that virus. We always have a number of upcoming programs. These are on our website. So there's a free lecture series that you can see on your left. It's easier to see if you go on the website and take a look at it. And as well as on the right, these are all about urology health, and we invite you to come. Lori has already reported that we are having our opening of our St. Armand's Urgent Care Center, our 6th Urgent Care Center, this October 2016. Hope is to have a patient through there before the end of the year, so we get somebody through before September 30th, and she's assured me that happens, right, Lori? Okay. It really, I'm sure you've all driven by the building recently. It looks fantastic. We got a little bit of cleanup to go and getting everything in, but it's going to be an incredible center when it gets going. And I think very well received come this season when we have our visitors here. We also marked a special milestone in the construction pavilion, rehab pavilion. Lori has reported where we were on our construction right now, but our leaders and members of the construction team gathered recently to celebrate an important milestone, which is the official topping out of our new 5-story pavilion. During an age-old ritual that signifies the construction project has reached its highest point, in this case 72 feet, the construction and hospital teams signed the final beam before raising it to the roof of the new pavilion. When complete, December 2016, the 74,000 square foot pavilion will replace the hospital's 30-year-old inpatient rehab unit located on the 9th and 10th floors of the hospital's east wing with a state-of-the-art healing environment and patients recovering from illnesses and injuries such as strokes, brain tumors, injured joints, spinal fractures, and trauma-related injuries. And one of you've heard us keep talking time and time again about how important it is to have this open during the month of December. One, we want to start treating patients in an advanced center. Another point, though, is we're trying to get ready for season. We're looking at the capacity issues that Lori was talking about during her report. This will free up 9 and 10 East Tower. We'll have a quick crew go in and do some refurbish at 9 and 10 East Tower and get those rooms ready for observation and admission patients. Probably won't be able to do a complete redo before season, but enough that we can get through season. After season, our plan would be to close those down, then do a complete refurbish of those, and for the season next year, have those completely redone and open for our patients. So, no pressure, Ms. Lang, Mr. Perigo. December? Okay. So mark your dates. The Rehab Pavilion grand opening is Saturday, December 17th from 9 a.m. to noon. We'll have tours and 10:30 of a program and a ribbon cutting. So we look forward to having everyone in the community that can be there. Dr. Malone also talked about in her report about our Johns Hopkins Center partnership that we've done down in Northport to expand the pediatric care in Northport. This was a great collaboration between Hopkins All Children's and Sarasota Memorial to be able to bring more specialists to Northport. And it's such a young community there that pediatrics seemed like the right thing to do. And they're enthusiastic about it. We are, and we can't wait to have that opening and come March of 2017. Our Newtown Internal Medicine Clinic, which is in conjunction with our internal medicine residency program, we will be opening that no later than July 1st of 2017. So I'm thinking Tom would stand up here in a second and just say, no, David, it'll open in June, because we want to make sure we have everything ready and everyone. Is that what you were thinking, Tom? I thought so. Because we want to make sure we get all the equipment in and the people oriented. What's that, Karen? And appointments on the books. So we are very much looking forward to having this practice in Newtown. Really think it hits just a number of community needs in that area, plus our own organizational needs of education and growth and capacity management. So thank you all for making that happen. And that is my report. Mr. Chairman, I'd be glad to take any questions if there are any.
Okay. Thank you, David.
Thank you.
Very much. I don't think we have any items on the consent agenda. Karen, public comments. Okay, thank you. Carol Ann, legal matters?
I have no report.
Okay. I don't think we have any other business. I just wanted to remind everyone, as Mr. Meister had said, our final tax millage hearing is tonight, or at 5:01 p.m. for the tax millage and budget hearing. So with that, we are adjourned. Thank you very much.